Welcome back on this Thursday. Good to have you here for Ozarks Tonight. I'm David Oliver. As we all well know, right now, our healthcare workers are on the very front lines of this COVID-19 pandemic across the world and right here in the Ozarks. We want to get some local perspective tonight on how things are going over at Cox Hospital. We're honored to have joining us the president and CEO of Cox Hospital, Mr. Steve Edwards, tonight. Mr. Edwards, good to see you.
Thank you, David. Good to see you as well.
First of all, this is Thursday. How are things today at Cox Health here in Springfield?
Well, every day is different, and I think our preparations are intensifying each day. We have 10 patients in-house that are positive right now, 14 that are presumed to be positive. That number is incrementally growing. Most of our work right now is really preparations, getting our new unit up and running, which should be open in about a week, which would have 51 more patient capability. We've drawn our census down through reducing elective surgery procedures, so we're about 200 lower in census. We've reconfigured our ER and triage area in Springfield, doing the same in other hospitals in our system. So much of our work is very much related to preparation. And the way I think our team looks at it is, if someone told you that you had 2 weeks to get ready for something and the result of your work could cost or save lives, how hard would you work? And our team right now is working as close to 24 hours a day as they can to keep this organization ready to prepare our community for what we're about to see.
When you talk about preparations, is that because you have a concern that we're about to see an influx of more patients locally?
Yeah, we have to be prepared for that. So, of course, we pray we don't. But the numbers are out there that we see across the country, across the globe, that there is a chance for surges, and those can happen when you don't have enough time really to get ready. So a surge can happen in a day or two, almost the way hospitals see these numbers. So we're getting ready for that. We don't see that necessarily right now. We actually see our numbers in Springfield. Our new cases are fairly stable in terms of new cases added on. That's an encouragement. It's a lot to do with social distancing. I'm afraid if we hadn't been doing that right now, we would be closer to a surge. We're seeing a lot of activity in St. Louis and those metropolitan hospitals. So right now, I feel there's a quiet before what could be a surge. I pray we won't, but we're getting ready for that possibility.
You were one of the very first locally to call for a stay-at-home order here in Greene County and Springfield. You were urging local leaders to do that. We saw that put in place. Do you feel, given the numbers you're seeing right now, that is making a difference here in our community?
So we've got some early data. We're a week into it. Cases essentially generally take 14 days. And so I think in another week or two, I'll be more confident. I can tell you right now that because the cases aren't raising rapidly, it's encouraging news. So yeah, I feel good about it. But this is not, as we said, not a blizzard. This is a winter, and we may be in the early part of that winter.
Tell me how you guys are doing over there at Cox right now in terms of your PPE. I know the Boy Scouts made a donation just yesterday of 30,000 gloves that I'm sure are going to be put to good use. But how are you doing? Are you getting the supplies and resources you need right now?
Yeah, so we have a sufficient supply right now. But when you get a surge, you can consume supplies at a rate tenfold quicker. And so we're trying to gear up for that possibility. We just got another 100,000 masks in this morning. That's really reassuring to me. We are worried about the supply chain being disrupted because we're seeing state support, barter, there's profiteering going on. And so we're looking outside the normal supply chain to get things in. We're also looking at these companies in town that are making stuff for us. So while we want to trust these will come in, we're not going to rely on that totally. We're going to work with our local manufacturers to help us as well.
Mr. Edwards, last weekend, the Missouri State Medical Association, which is a consortium around our state of doctors all across Missouri, tweeted out and said this. And I want to read the tweet to you. It said, "April is going to be absolutely brutal. Get ready, hunker down. It might end up being the worst month in the history of this country." Do you share that sentiment?
Well, I think if you're in New York City right now, you would say that. I think in Chicago, you would say that. I think the peak will happen in different communities at different times. Our peak maybe will be pushed back a little bit. I think if we did a full state measure to mandate, we would be a little safer. But because our big cities have made these commitments, because Springfield, Greene County, and Christian and Webster in our area have done that, that's very helpful. we'll see the peak hit different communities at different times. I'm hopeful that because of the community leadership, people like Clay Goddard and Ken McClure, our mayor, and Bob Dixon, our presiding commissioner, who made that decision, which took courage, that we will be pushed back and we can flatten our curve. It appears right now that positive things are happening. It's too early to be confident in that.
Talk to me just real fast. We got about a minute left to go here. How is your staff doing? I know you tweeted out today and you said you were very proud that annual pay raises were still able to be given out to the staff there at Cox, and I know you were happy about that. We're watching reports all across the country where hospital workers are just having a really tough time, and I'm sure that has to be the case here too, but how is your staff doing?
You know, I think that it's a time for some anxiety for people. At the same time, these are people that at some point in their life decide to be in healthcare, and this became that moment they're ready for. They're people that are geared for crisis. They're people that are called to duty. Doesn't mean they do it without fear. I think that if we can make sure we protect them by getting the PPEs, they'll do anything for this community. If we can't protect them, I get that anxiety. So that's why our system is so focused on getting the goods we can, the supplies we can, and making what we can. I think our attitude is, it's amazing to me. You walk around these hospital corridors and people are smiling. And I've said in other interviews, it feels like what I imagined those that are about to land on Normandy Beach felt like. Adrenaline, geared up. They want to serve their country. They want to serve our community. But we're aware there's fear too. And so we want to make sure we protect them and support our employees.
Last 15 seconds. Is it too soon to be cautiously optimistic here in our community?
I think so. We want to continue to plan. If we become optimistic and let our guard down, we're in trouble.
Okay. Mr. Steve Edwards, the president and CEO of Cox Health, I really appreciate your time today. I'd like to invite you back maybe in a few weeks. We'll check in and kind of get an update on how things are going over there for you.
Thank you, David. I appreciate it. I'll be glad to do that.
All right. Be well, sir, to you and your staff. And we'll have more Ozarks tonight after this quick break.